Good morning. Good afternoon.
Good afternoon. Good afternoon.
Am I audible now?
Yes, 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 yes.
I'm audible.
Renewable might be joined from the two system. So echo is coming. Renewable, you are not audible.
Now I'm audible.
Yeah, you are audible.
Yes, yes, yes.
So today is your paper one. That is 31 paper, and unit one we have to discuss. Under that, first individual and family response to critical illness. The unit one we have to study. So under this is your paper 3-1, BNS-31, and the block 2. Out of the in this block 2, there are 4 units. The unit 1 is individual and family response to critical illness. Unit 2, stress and crisis management in critical care. Unit 3, guidance and counseling. And unit 4 is therapeutic communication and interpersonal relationship. So are you clear regarding which paper and which unit we are going to discuss?
यस
मैम
मैम
श्लोक देखो।
मैम 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 मैं
Yes.
पहले यहाँ पे एक बात करना चाहती हूँ कि हम लोग जो ई कंटेंट इग्नू ई कंटेंट का जो डाउनलोड स्पेस है डिप्लोमा का, तो वहाँ से तो मतलब डाउनलोड हम लोग नहीं कर पा रहे हैं। आज हो गया 1 हफ्ता हो गया, हम लोग बिल्कुल भी डाउनलोड मतलब वो साइट नहीं खुल रहा है। अगर आप 032 का अगर पीडीएफ
You have the content. I will send you in the class. Okay.
हाँ 032 का मैम पूरा जो है ना डाउनलोड मतलब पीडीएफ जो है
Okay.
मतलब सिक्स ब्लॉग जो है अगर आप भेज दे तो बहुत अच्छा होता।
Okay, I will send you after finishing the class. Okay.
ओके थैंक यू मैम
Okay, very good. So this is the paper 031 and the block 2. Okay. Block 2. And under block 2, that is 4 unit. And the first unit now we are going to start, that is the individual and family response to critical illness. Okay, clear which paper, which block and which unit we are going to start?
मैम और एक बार बोलिए क्योंकि मैं थोड़ा लेट में आई हूँ तो थोड़ा एक बार बोल दीजिए एक बार.
Okay, so now we are going to start paper 1031. Okay, 031.
Yes ma'am. Yes ma'am.
Block 2, there are how many blocks? 6 blocks. In one paper, 6 block, 031, block 2 and unit 1. We are going to start. Clear, everybody?
Okay.
Yes, ma'am.
Okay. So let us start that topic. So the name of the topic is individual and family response to critical illness. So anybody can say me, what you understood by critical illness? Have you any idea? Yes or no? Am I audible? Am I audible?
Yes, ma'am. Yes, ma'am. Yes, ma'am.
So, what is a critical illness?
Critical illness is a traumatic event for both of the patient and the family.
So, many countries.
Critical illness is a condition of dysfunction of vital organ and which needed a critical care.
So, in that case, both physical and psychological status of the clients is disturbed, isn't it? And if a patient admitted a critical ill patient, maybe is admitted to critical care unit. And do you think that there is any response to individual or family members, or they undergone the same response before the illness? Any changes in their response? Yes or no?
Yes ma'am.
Yes. So anyone can say me what may be the possible individual response?
The attendants become more anxious about the patient's condition.
Hmm?
Sometimes breathing difficulty.
Physical response, psychological response.
So individual response, not only the physical response, it also contains your psychological responses. So let us see what are the responses. So critical illness is a traumatic event for both the patient as well as the family. The patient who experience trauma or sudden critical illness are admitted in critical care unit or CCU. They face not only psychological but also physiological illness. The psychological trauma affect the patient as well as the family. There are interrelationship, as you know, where body and minds are interrelated. So when the physical status is changed, ultimately the psychology of the patient is changed. The psychological response, what happens when a patient is admitted to the ICU or CCU? What is the psychological response? Fear, anxiety, isn't it? And these psychological factors aggravate the physiological symptoms. That is, if the patient is having pain, then pain is aggravated. Hemorrhage, if they are bleeding, they are aggravated by your psychological responses. As a critical care nurse, you need to understand the psychological concerns of the patients and families and help them to cope with the situations. Okay? While providing the care, you may come across with the patients and healthy members from various cultures. In order to provide culturally competent care, you require an understanding of cultural differences in healthcare practices and patients' cultural beliefs and practice. So, what is the effect of critical illness on individual and family? So, there are individuals. First of all, we have to discuss effect of critical illness. First, how it will affect on individual. Then we will discuss how it will affect on the family. So, can you guess if a patient is admitted in the critical care unit, then what are the physical psychological changes you may find? Tell me once more.
मैम फिजिकल में
Physical
हाइपरटेंशन
illness means
और
vital signs.
Physical changes रे हमें कौन देखिए? The physical responses of the patient is exhibited by changes in the first vital sign.
टैकीकार्डिया, टेकपनिया,
Tachycardia, tachypnea, hypertension, dysrhythmia, diaphoresis. What is the meaning of diaphoresis?
एक्सेसिव स्वेट,
Excessive
Perspiration.
sweat.
Very anorexia. Why it is?
नो अटेंडेंट्स आर
Lot
देयर,
of loss of appetite.
Loss of appetite because of psychologically she is very anxious, depressed. Huh? Changes in elimination pattern. If intake is not proper, then definitely elimination it depends upon diet as well as it depends it is also controlled by your nervous system. Then increase pain, increase hemorrhage, restlessness, and alter circadian rhythm. So circadian rhythm कौन? Sleep cycle. Okay. So these are the physical responses found in the patient who is admitted in intensive care unit. Next changes psychological responses. So what is the psychological responses? The psychological responses, the patient may feel anxious, fear, anger, grief, dependency, frustration, powerlessness, helplessness, hopelessness, and spiritual distress. Few patients can develop intensive unit syndrome. Anybody can define what is intensive care unit syndrome? So are you agree? What are the above psychological responses I'm showing you? So is it truly happening or just it is written in this paper?
नो मैम वी आर एग्री.
Okay. So tell me, what do you mean by intensive care unit syndrome? Intensive care unit syndrome. The meaning, intensive care is the combination of two words, intensive care unit, ICU plus syndrome. So the meaning of ICU and what is the meaning of syndrome? Last class we have discussed. Syndrome means, what is that? A group of signs and symptoms. So the intensive care unit syndrome is a syndrome, that is the group of symptoms that usually occurs after 48 hours of stay in ICU or CCU. Whenever a patient is admitted, so after 48 hours of admission, he has to show so many signs and symptoms. This is because of psychological factors, that is called as intensive care unit syndrome. Because of the instrument, because of the so many unknown cases, so many unknown people, the healthcare personnel, and so many invasive and non-invasive procedures, the person is seeing so worried, anxious, fear, and that's why the psychologically, that is the psychosomatic symptoms will appears after 48 hours admission to the intensive care unit, that is called as intensive care unit syndrome. Everybody clear about the term?
यस मैम.
Yes. So due to it is because of environmental responses. So the unit syndrome is because of the environmental responses of the patient, that is the sensory overload, sensory deprivation, and intensive care unit syndrome. So these are the environmental responses. First of all, we have discussed physical responses, psychological responses, then environmental responses. To the environment, how the patient will respond. So there is mainly three things, three responses: sensory overload, sensory deprivation, and intensive care unit syndrome. You have now understood what is the meaning of intensive care unit syndrome, isn't it? So, what do you mean by sensory overload? Anybody can tell me? Sensory overload कहले कौन बुझे? Tell me. Anyone?
The body
Anything
senses
coming to
experience over
what?
body senses experiences over stimulation from the environment.
Yes. Because
Sensory overload means they feel more pain.
of too many stimulating the sense organs of the patients. Okay.
Yeah, one or more than body senses.
Yes. That is the sensory overload. Sensory deprivation. What is the mean? Reduction. Just reverse to the overload. Reduction of the stimulation of the sense organ leading to disorientation. So this is the just reverse to the sensory overload, that is sensory deprivations. So common features of the syndromes are ICU syndromes, intensive care unit syndrome. What is that? How we'll identify that the patient is having intensive care unit syndrome? Because whenever a patient is admitted, then after 48 hours, if you are going to find these symptoms, that is disorientation, clouding of consciousness, decreased attention span, memory loss, hallucinations, and emotional instability, so the symptoms disappear within 48 hours. The patient transferred out of ICU and CCU. So if the patient is discharged or shifted from ICU or CCU, then within 48 hours the symptom will be disappear. Okay. So can you able to find out what are the intensive care unit syndromes? The features, that is the disorientation, clouding of consciousness, decreased attention span, memory loss, and hallucination, emotional instability. Clear?
Yes, ma'am.
Okay.
Yes, ma'am.
So, why? What are the factors contributing these syndromes? That is advanced age, very severe illness, prolonged surgery, use of cardiopulmonary bypass, history of psychiatric illness, electrolyte imbalance, etc. Endocrine disorder, sleep deprivation, sensory overload, and sensory deprivation. So these are the factors. If a person is very old age, definitely say the various idea coming to his mind that my age is so advanced, I may not be survived. Now I am admitted in ICU. Similarly, very severe illness, if a patient is having chronic illness, diabetic coma, or CKD, or hypertensive crisis, so many factors, many things coming to their mind, and they thought that so many things will go happen. So that's why ICU syndrome will find. So as a nurse, what will do? The nursing intervention in caring of a critical ill patients. What you will do? If you are going to find that the patient undergoing this, a patient admitted in ICU or CCU having this psychological response.
Patient promote the physically and mentally support.
Yes. So individual response, whatever may be the individual responses, that is physical, psychological, or environmental, and you are going to find out these responses. Then as a nurse, what you will do? So nursing intervention in caring a critical ill patient who have towards their responses. First of all, comfort, isn't it? Promote physical comfort to the patient as much as possible. It should provide comfortable positions, comfortable bed to the clients. As you know, proper
Rotation, proper air mattress, air water proof mattress,
in
rotation, patient
yes,
rotation and
listen me.
proper Fowler
Patient is on
patient
bed,
uncomfortable, huh?
but These are the in if the patient is conscious, so no need to provide that type of patients. And mostly it is happen in the conscious patient, the responses, isn't it? If the patient is unconscious, then these responses you may not find in that case, because physical, psychological, environmental, this the patient is aware, then the symptoms will arise. Okay. So first of all, you should provide a comfortable position to the client, comfortable bed, and to relieve or control pain. If the patient is having severe pain, then analgesic you have to advise, you have to administer according to the doctor's prescription. Nursing activities planned carefully to provide adequate period of uninterrupted sleep. In such a way, you should provide nursing care in such a way that you never disturb to your clients in while they are sleeping. Explain the procedure to the patient before carrying out. Before and after the procedure, allow the patient to ventilate his feelings and conscience, isn't it? So keep the patient informed about the treatment options, prognosis, and encourage patient's environment in related decision makings. Provide emotional and maintain spiritual support. Everything you have to give comfort to the clients. You have to give analgesic. You should not disturb or carry out all the nursing procedures while the patient is in a, and while the without disturbing the patient's sleep. You have to explain everything whatever you are doing for the clients. You have to ventilate, allow the clients to anything she has to ask, or anything she has the doubts, you have to clarify all these things. Okay. Then support, emotional and maintenance, spiritual support you have to provide to the clients. Then promote privacy and dignity of the clients. It is very much essential. You have to if you are doing any procedure for the clients, you have to maintain privacy, avoid conversation about other patients and personal issue within the patient sharing aids, hearing within the patient hearing range, provide a comfortable environment, provide a calendar or clock within the patient's visual field, ask family to bring some personal objects to place at the bedsides. So, provide comfortable environment, calendar or clock within the patient's visual fields. Avoid conversation, unnecessary conversation. You should not conversation with the with other materials without regarding the patients, and privacy, and is very much essential for the clients. Then family response to effect of critical illness and nursing intervention. So whatever things we have already discussed, these are about the patient's response. So not only the patients will suffer, but also while a patient is admitted in ICU or CCU, the family has also undergone through many crisis conditions. So how their response will occur, and at that response, how a nurse will provide care to that family also. So anybody can tell what are different family responses? If a patient is admitted in ICU, then is there any impact on the family members?
Yes.
Yes, ma'am.
So how they will feel, how they will respond? First of all, the responses, the reactions of the family members is decreased ability to concentrate and use incoming information. Decreased ability to concentrate. Is it happen? Yes or no? Yes or no? Tell me.
Yes, ma'am.
So the first response of the family when when a patient is admitted in critical illness, that is, they have decreased ability to concentrate and use incoming information. their concentration and taking information ability will decrease, because during crisis people have difficulty in hearing and understanding the information. If your relative or your close one, your very loving one, is admitted in the ICU, so you are not concentrated, your concentration will be disturbed. You cannot concentrate, so that you cannot hear and you cannot understand. Even if the doctors and nurses, they explain you what about the disease conditions, what is the prognosis, many times you are going to ask and you didn't clear about that. It is because of you have the decreased concentrated ability and incoming information. After the patient is admitted, the families are need to receive a lot of information about the patient, the unit, the seat, whatever the test, whatever the treatment procedures, what are the prognosis of the client, anything you have to explain. Since the family have difficulty in understanding the information, it is frequently seen that they are asking the same questions to different healthy members repeatedly. The doctors is coming, they're asking to the doctors, they're asking to the nurses, even if whenever they see anything, any person around the clients, they are asking more and more repeatedly, because they are so excited, so anxious, and they have very under the fear conditions. So their concentration ability, their understanding ability, these are decreased. That's why even if silly things they cannot understand properly and asking so many times repeatedly. Okay, so these are the response. After that, we have to discuss what the nursing intervention. The next response of the family members: decrease ability to make decision and solve problem. In that conditions also, whenever their close one is admitted in CCU, the family persons, they have the decreased ability. They cannot take the decision properly instantly. They are confused regarding what to do and what not to do. So very often families of critical ill patients need to make difficult decisions regarding the life of the patient. Giving consent for surgery whenever treatment should be withheld. In critical care unit, there are many patients. Those patients cannot survive, even if whatever the procedure you are given, they cannot survive. In that case, withholding is required. The patient will live no more whatever the treatment you are providing. So even if the doctor already told that your patient there is a brain dead, so can you withhold the patient from ventilator or not? So after knowing that my patient will never live more, even if they cannot give the consent very easily to withhold the treatment. So this decision making ability will be decreased. So please mute your mic. In addition to making difficult decision regarding treatment, also the care of the patient. Mr. Ring, please mute your mic. Sudipta, Sudipta, please mute your mic. Sudipta, Sudipta, please mute your mic. Okay. So, in addition to making difficult decisions regarding treatment and care of the patient, they are frequently found to have problems in deciding about daily routine also. So, clear? Whatever the treatment they will provide to the clients, whenever the doctor.
সুদীপা সুদীপা তুমি তোমার মিউট করো সুদীপা মিউট করো ডিস্টার্ব হচ্ছে
Okay. So, even if repeatedly, in addition to making difficult decisions regarding treatment and care of the patient, they are frequently found to have problems in decision making. So now you understood. There is another response is decreased ability to make decisions and to solving the problems. Okay, clear about this? This is also one of the family response. Understood? Yes or no?
Yes, ma'am.
So the next response of the family when a patient is admitted in ICU, decrease sensitivity to or awareness about the environment. The family is unaware regarding their surroundings. You can feel, for example, whenever you are so stressed, you are very much stress conditions. Do you feel? Do you remember how do you feel? Only that things is coming to your mind. Only that things coming repeatedly to your mind. So whatever the things happening in your surroundings, you cannot aware about that. Similarly, whenever a very loving one is admitted in CCU, you only think about that person. Repeatedly, the thought, wow, what will happen to my relative, my relations? Is there any no problem? Is there anything wrong is happening or not? So these are the unnecessary things, the negative thoughts coming to your minds repeatedly, so that it is frequently seen that family exhibited lack of awareness about their surroundings. This lack of awareness about the surroundings makes the family members standing in the doorway and blocking the passage or talking loudly in the waiting room, disturbing other families. Okay, so they are repeatedly standing in front of the door and blocking the passage and repeatedly asking the questions. So this is one of the response of the family members. Next, decreased sense of personal effectiveness. So since the conditions of critical ill patients are so complex and critical care, their care is totally under the control of the critical care nurses and other health team members. Families not able to provide anything, any care. They feel themselves themselves helplessness and ineffective. Okay, so some closed one. They are suppose a wife is admitted in the CCU care unit and he has to care for the wife, but this is out of his control because the patient is under the critical care health team members and not able to, and he is unable to provide care to the closed one. That's right, the person is feeling that I am helplessness and ineffective to provide the care to my closed one. So this is a decreased sense of personal effectiveness. So next one is stress related to the changes in structural role. That is the stress related to the changes in structure and roles in the family. So this is another response. So what happened here? What are the responses? Here the psychological responses. The family experience stress as well as critical illness and hospitalization of their loved ones affect their ability to function. Critical illness may disrupt family structure as well as the function when the family's energy and efforts are totally directed towards the patient. Because whole family is under stress. That is the changes or the response of the family. The whole family is under stress because the loved one is in ICU and their total energy, they are repeatedly going to ICU, they are repeatedly financially, physically, and totally their energy is towards the patient, towards the CCU, so that they totally aware about the patients and other things are disturbed. Drastic role reversal by wife or husband of the patient contribute to an intense sense of loss and stress of the family. So their they are under stress, their total activity is for the patient and they were unaware, they cannot also care themselves and other family members. Then what are the nursing intervention to meet the emotional need of the family? So what is the role of a nurse while these are the responses occurs in the family? So can you tell me what is the role of a nurse towards these family members? Anybody can tell? Towards family, is there any role of the nurse is there or not?
Yes, ma'am.
So, what you will do for the family member?
Ma'am, firstly, we discuss about the disease process, then treatment facility, and also uh,
now which procedure we can serve to the patient, we discuss, and also then psychological and mental support.
Yes, very good. So these are the nursing intervention. A critical ill patient not only requires support from the critical care team, but also requires support from his family. Okay, the patient not only gets support from the critical unit team, but family support is also essential. So, while taking care for the critical ill patient, the nurses has to see that family's needs are also met. The family who is coping well with the critical situation will be able to provide supportive environment for the recovery of the patient. Then these are the nursing information, nursing role towards the family. So provide information. Provide FORMA ଟିକେ ଓଟା ଛାଡି ଯାଇଛି I have left. So provide information. As a nurse, you have to provide complete, accurate information to the family regarding according to their need and understanding ability. Also, you have to give accurate information. If the patient is very illiterate, it's not literate, she is illiterate. So you have to explain in such a way that the patient can understand easily, then give precise, simple information, and it should be non-technical, non-medical term. You have to explain to the family what is happening with the clients, and everything you have to explain. Discuss with the family the difficulties or the probable events may occur in future. Okay. So, what are the possibility? The prognosis of the clients you have to explain to the family members. The first role is provide information to the family regarding the diagnosis, regarding the procedures, regarding in the simple terms, in non-technical term and is non-medical term. Next intervention towards the family is provide assurance. You have first one explanation, second one assurance. You have to give psychological support, assure the family that the patient will be made comfortable as much as possible. We are trying to keep your patient in a comfortable position. Explain to the family that the patient will be closely monitored and will receive highly skilled care. Because whenever a client is admitted in ICU, the family members they have different thoughts coming to their mind that my patient is maybe neglected, maybe anything happened wrong to her. So everything is explained by the nurses that we are very closely monitoring your client with highly skilled care and provide accurate information regarding the patient's conditions from time to time. Though in CCU, the family members are not allowed to remain there with the clients. So time to time, they are very eagerly waiting to know what about the client's conditions. And in that case, the healthcare personnel, the nurses, they should inform accurate information regarding the patient's condition from time to time. Then support. Provide assurance. After assurance, you have to provide support to the clients, assess the family structure, function, and usual coping mechanism. You should assess how the coping mechanism they applied, respect the family's coping behavior, and enter when only when harmful for the patient and family. Allow the family to ventilate their emotions. So, provide necessary information and guide family to take decisions. Inform family to available resources like finances. So whatever the things coming, there are many things under different finance also helping for the clients. There are different schemes. You should explain all these things to the family members. Then facility proximity. Another intervention, nursing intervention towards the families, facility proximity. That means the need to be with the patient. The meaning is the need to with the patient. So as a nurse, you have to clarify, you have to explain all these things to the family members, prepare family member for visiting, how they visit to the clients, individualized visiting may be allowed according to the need of the patient and family. Sometimes the patient need to see the family members, and according to the need of the patient, the need of the family, you have to help the clients how the family members how they will visit to the patient. assess the families need to be with the patient, prepare family members for visit, then assist family member to be near to touch the patient if they wish. Then encourage family members to communicate with the patient. You have to encourage the family members, talk with the patient, laugh with the patients, and communicate. That teach the family members how to assist with the patient care. Also, being an intensive care unit nurse, you have to explain all these procedures. So something, for example, if a patient is taking the tube feeding or the catheter care, or if it is a prolonged care patients and she has to be discharged, and after that in home the family members will carry certain procedures. So you have to help the, you have to teach the family members how to assist them. Then advise the family member to take adequate rest, nutrition, and exercise. You have to also advise that you should take proper rest, take good nutrition, and do exercise to cope with the stress and crisis conditions. Then provide comfort is also another responsibility of the nurse. They have to provide comfort to the family members. So how? They have to explain regarding the waiting room, telephone, cafeteria, etc. near to the unit to the family. Provide information on the source and facilities that may be needed near the hospitals. You have to explain these are the facility available near with you, and you can go through that. So these are the responses, these are the interventions the nurse can do towards the family members. So what are the points? Anything can, anyone can explain me? Under nursing intervention, what are the nursing intervention for the family?
And the first point is provide information to the family, and the second one is the
Very
assurance
good.
to the family, and the next one is the support to the
Yes,
family, in which the family structure, function, and usual coping mechanism are being told. And the second
very good.
last is facilitate proximity, and its meaning is the
Yes,
need to be with the patient. And the last one is
yes,
the provide comfort, like showing the waiting room, letting them know about the telephone, cafeteria, and the other
very
hospital
good.
facilities.
Thank you, Ankita. Your Ankita is telling now.
Yes, ma'am.
Yes, very good. You have explained all these things, whatever we covered, very nicely. Thank you.
Pleasure, ma'am.
So these are all about the patients and family response and the nursing intervention towards the patient and family. So next, another things we have to discuss regarding the socio-cultural factor affecting the critical care unit. Do you think it is it true? Socio-cultural factor affect the critical care while we are doing the nursing care?
Yes, ma'am. It basically directly affects the patient health, because culture affects based on their knowledge, values, and beliefs,
Yes,
and
very good.
the habits of their family members. So
Yes, good.
from the habits of the family members, we can also assess the habits of the patient.
Okay.
So then we can
Ankita is
accordingly
responding
treat the
very
patient.
nicely. Yes, yes. So here, so first of all, we have to understand what is culture, what is value, what is trans culture, everything. Huh? So culture, what is culture? Culture is, tell me, what is culture? What is culture?
Ma'am, culture is a totality of values and beliefs, basically the customs of the family is the culture, I think.
So not only,
And it shows the pattern of behavior also.
value, belief, it is the sum total of knowledge, value, belief, art, moral, law, customs, and habits of the members of the society. Okay. Sum total of knowledge, whatever the knowledge you are having, whatever the value, whatever your belief, your art, your moral, your law, your customs, your habit, everything that is mixing, that is your culture. Cultural pattern of the behavior develop over time. Remember, culture is not developed suddenly. It will develop over time and are served by members of the same cultural group and transmitted from one generation to next generation. Your You are learning it from your family members, from your society, from your culture, from your society, from your environment. Not instantly. It is gradually from your generation to generation. Culture affect way of perceiving, behaving, and evaluating the world, and serves as a guide for people's value, belief, and practices, including those related to health and illness. Culture affect your health, illness, your nursing intervention also. What is value? Value are the set of rules and ideas or principles observed by the individual, groups, or community. The rule regulation. What are the principles? You are a principle person. That is your value. You are following certain rules and regulations. This is your value. Value determines also our beliefs, attitude, and behavior all over totally. The culture and value they are developed gradually. A child may be unconsciously develop this value and learn acceptable or to unacceptable behavior through individual within the cultural group. And this uniqueness may be based on age, sex, marital status, educational level, family structure, income, religious belief, and life experience. It will throw cultural imposition. What is that? The cultural imposition. Anybody can tell what is cultural imposition? The cultural imposition is that we are forcing, imposing. That means we are forcing one's own cultural beliefs, value, and practices on another person or group. हमें forcefully जनको we are forcefully tell somebody to apply another culture. That is cultural imposition. This is not a, this is very bad. And what is trans culture? Trans culture. Transcultural nursing is a specialty that studies and compares the difference between various culture and subculture. The goal of transcultural nursing is to provide culturally competent care to the patient from different cultures. Transculture means different cultures, exchange of culture, different communities, different culture. So compares. Transcultural nursing means this is a specialty nursing that studies different culture, that compare different culture, and she can analyze how one culture is difference between another culture and subculture. And the main goal or aim of transcultural nursing is to provide culturally competent care to the patient from different culture. Whatever may be the patient's culture, the nurse is able to provide the competent care to that clients. Okay, she is able to provide the care perfectly, whatever may be the culture of the clients. That is the transcultural nursing. Able to get? Able to get what is transcultural nursing? Yes or no?
Yes, ma'am.
Yes. That means in transculture means transculture means different cultures. So transcultural nursing means a nurse who is able to provide his care, provide special care to that clients, whatever may be the culture. So, social cultural factor affecting critical care. Under that, first we have discussed what is culture, socio-cultural factors affecting critical care. Now we are discussing what are the socio-cultural factors affecting critical care. Under that, first we have discussed what is culture. Next we have discussed what is value. Next, what is cultural imposition, what is trans culture. Next, socio-cultural assessment. The socio-cultural assessment, under that, first of all, this nurse should assess herself by nurse's self-assessment. Under that, the socio-cultural assessment of the patients forms the basis for providing culturally competent care to the critical care inpatient. Before performing patient socio-cultural assessment, the nurses should understand her own cultural background, her own value or belief, especially those related to health and healthcare practices. If the nurse is not clear about her own culture, sorry, spelling mistake, she cannot objectively consider her patient cultural orientation and its. First of all, you have to understand what is my culture, what is my value, what is my belief. Then she is able to understand patient's cultures and value. Several tools or guidelines are available by which the nurse can evaluate her own cultural assessment as well as patient's cultural assessment. Nowadays, uh, very there are different tools and guides that are available in website also. By using that, the nurse can assess his or her own culture as well as the patient's culture. Next, patient socio-cultural assessment. The critical care nurse should perform a cultural assessment of her patient and include its nursing process. Sure, under assessment in nursing process, it is required for the assessment of the culture. Why? For caring, because nursing process is required for providing care to the clients. So for care, nowadays individualized care is essential. So cultural assessment, like any other assessment procedure, may be completed over a period of time as the nurse and the patient come to know each other. Cultural assessment can be performed by using the Ziegler and Daviger model of cultural assessment guide by modified and discussed below. So there is a model, that is Jigger and Daviger's model. I can explain these things. What is that model? Under that model, first things, communications. So first thing, communication. So under communication, which includes verbal and non-verbal communication pattern of the individual. So how you will assess different cultures? By using communication, that is verbal communication or non-verbal communication. Next, social organization, the form of the family and the community from which the individual comes. You have to assess from where the patient is coming, how the family members, then time, whether the person is future oriented, past oriented, or present oriented. Then time dimension, this factor determines how person view his experience. The past oriented, whether the client's experience and tradition give more importance to the culture from which he belongs, or whether the client is present oriented, future oriented, the same thing repeated. So here, first one is communication, second one is social organization, time dimension, past orientation, present orientation, and future oriented. Because from these are the scales, these are the points you have to collect, you have to assess during the socio-cultural assessment. Under this point, these are the guides, these are the scales. This is developed by Jigger and Davidgers. So while you are, by focusing these points, you have to assess the client. So first one, what is that? Communication. So you can apply verbal communication or non-verbal communication, or whether the clients verbally express or non-verbally. Then social organism, which type of family is belongs to. Then time, whether the client is present oriented or past oriented or future oriented. By that you can know that the patient is with whatever the care you are going to provide, the patient can adjust. If the patient is past oriented, for example, tradition are given more importance, from which culture you have to come. Suppose in, for example, in future oriented, past is, that is past is gone, and how the action of the present can improve the condition of the future. For example, different kinds of patients are there. So in future oriented, so this point is clear or not, or explain some more? Socio-cultural assessment. First, the nurse should assess self-assessment, then patient's assessment. So in patient, while she is assessing the clients, then she has to follow one of the model that is called as Ziegler and Davidiger model. Okay. So according to this model, she has to focus 1, 2, 3, 4, 5, 6, 7 points: communication, social organization, time dimension, past orientation, present orientation, and present and future orientation. So these are the points she has to focus. So let us discuss these points. After that, you will be able to understand that model. So while meeting a patient or his family member, the nurse will introduce herself, Okay. So past oriented means कौन? I'm giving example. One point is there past oriented. Past oriented people may have strong belief about the cause of illness and the treatment, which he has to learn from his experience. She has not become cooperate with the treatment plan if they don't support his beliefs. Okay, past oriented means the patient is so old, she cannot cooperate with you for the modern techniques, modern care. In that case, you have to assess the clients. You have to also support other family members to explain all these things so that you can change the client's conditions, the client's mental status. After that, gradually you have to provide care. Okay, so these are the patient's cultural, socio-cultural assessment. After that, socio-cultural factors in planning care. What are the socio-cultural factors coming under planning of care? So while meeting a patient or his family members, nurse should introduce herself. First of all, self-introduction is essential. While the client is meeting to the, while the nurse is meeting to the patient or family members, address the patient by name. You have to address the patient by name or sir or madam. While communicating, take adequate time. Don't, you should not so hurry that I have so many work and I have to communicate very fast. Avoid communication in a noisy environment. Make the patient in a comfortable before beginning communication. Sit or stand in front of the patient in such a way that she has to see the nurse's face clearly. Speak slowly, clearly, using simple short sentences. Individual and family response to critical illness. Don't raise voice. Okay, so next point is that don't raise so many so loud voice. You have to, and use gestures with caution as their interpretation vary from culture to culture. Use any word that you might know the patient's language. If you know the patient language, you have to use it. Ensure that the patient understand by having him repeated the instruction, demonstrate the procedure and act of meaning. So this is all about the socio-cultural factors in planning the care. So anybody can tell me what are different socio-cultural factors for planning the care? So whatever the points we have discussed, these are under your communication points. What is that? All are your communication, under communications. So in communication, these points you have to cover. Next, cultural health practices. So what is that? Socio-cultural factor. First one is over, communication is over. Second factor, cultural health practices. So cultural health practices, individual has different cultures. The patient may have take some traditional and folk remedy that might affect the treatment procedures prescribed by the physician. So in critical care, nurse has to ask the patient regarding the use of such traditional medicine and other beliefs plan for nursing care accordingly. So next, social organization, and after that the decision making in critical illness is another factor. So there are mainly four factors which can affect in planning the care. Okay, so everybody understood or any doubts? I think in this point some doubts are there or not. Ankita, hello, hello, am I audible?
Yes, ma'am.
So we are whatever the things we have discussed, I am going to previous. So first of all, what I have discussed from starting, I have discussed Effect of critical illness on individual. Yes.
Yes, ma'am.
Under that, individual's response is physical response, psychological response, environmental response. Okay. After that, we have discussed nursing intervention in carrying the critical illness towards the patient's response. Clear? Yes or no?
Yes, ma'am.
Yes, ma'am. Yes,
Okay.
ma'am.
So next we have discussed regarding family response to the effect of critical illness. Under family response, that is, first one is decreased ability for concentrating and using incoming information, decreased ability to take decision and solve problem, decreased sensitive to awareness about intervention, decreased sense of personal effectiveness, and stress.
Related to the changes in structure.
Yes. Next, nursing intervention for the family, emotional need of the family. Under that, we have discussed provide information, provide assurance, provide support, then facility proximity, then provide comfort. Up to this, you are clear?
Yes, ma'am.
Yes. So next, I have discussed the socio-cultural factor affecting critical care. The point is that first one response, next one socio-cultural factor affecting the critical care. So under that, we have discussed what is culture, what is value, what is cultural imposition, what is trans culture. You clear these things? Clear or not?
Yes, ma'am.
Because social culture is very much essential. This assessment is very much influence on the patient's care. If we don't know the patient's culture, the value, it is very difficult to provide the nursing care. So after that, we have discussed sociocultural assessment. The first, nurses self-assessment. After that, patient sociocultural assessment. So under that, we have to follow sociocultural assessment. Patient, how will assess patient sociocultural assessment? By following the model, that is Jigger and David's model. Under that, what are the points under that model? Communication, social organization, time, past orientation, present orientation, and future orientation. By using this model, Jigger and David model, we have assessed the patient's socio-cultural status. Okay, up to this you have clear? Yes or
Yes,
no?
ma'am.
So next, we have to discuss socio-cultural factors in planning care. So first factor is communication. The communication has a very much essential. So different factors. First is communication factor. Second one is cultural health practice of a person's factor. Third one is social organization, family, and decision making ability of the critical illness and diet. These are the five factors affect the in planning the care. These are five social cultural factors affect in planning care. First of all, so, so socio-cultural factors in planning care. Under that, what are the points coming? Tell me.
Communication,
Very good.
cultural health practice,
Yes. Social
social
organization,
organization,
decision
decision
making,
making in critical illness, and
and
diet.
diet. So I think you'll read it or you need some explanation. So you can tell me one by one how communication will affect in planning care. Tell me how communication is a socio-cultural factor which can interfere in the planning care. Anybody can tell me? Tell me. Is communication a factor in providing nursing care? The point is that under that we are discussing the socio-cultural factor in planning care. Okay. So socio-cultural factor in planning care under that first point is communication. Do you think that communication is a factor?
Yes, yes, ma'am.
Yes. How? How? Everything is
By
need in communication. The care
communicating with the patient.
assessment, you cannot, if communication is not proper, then we cannot assess, we cannot diagnose, we can't provide care also. The disease cannot be diagnosed properly, and we cannot provide adequate care if the communication is not good and proper, isn't it? Establishing
Yes,
effective
ma'am.
communication with the patient is absolutely essential for providing holistic care to the client. Effective communication occurs when meaning are mutually understood, whether the communication is through spoken words, written materials, gestures, or voice. To show respect to the patient, communication should take into account the patient's usual communication style. Uh, Under that, we have discussed so many points how we have to effectively communicate to the family while meeting, how in the local language, in the simple language, then address the patient by name, communicate at a adequate time, not should not show hurry, don't raise voice, speak slowly, clearly, using simple short sentences. Okay, so these are the points under communication we have to discuss while planning the care. So next one, after communication, next factor in planning care is, next socio-cultural factor in planning the care is cultural health practices. So do you think that cultural health practices is a factor in planning the care? Yes or
Yes,
no?
ma'am.
Yes. So different persons have different cultural practice. So as a nurse, you should understood the culture of the clients, and accordingly you have to provide the care. For example, if an individual belongs to different culture groups may show diverse health related cultural belief and practice. The critical ill patient may believe that his illness is due to punishment by God, and may not feel, and they may feel hopelessness. Patient may have taken some traditional and folk remedy that might affect the treatment procedure and prescribed physician. Okay, so the critical care nurse has to ask the patient regarding the use of such traditional medicine and other belief plan of nursing care accordingly. Some patients thought that in health practices they have different that this disease is due to punishment by the god, due to yes, punishment by god. That's why they are using different traditional remedy, traditional methods, and by also physicians, some traditional methods remedies are helpful. For example, yoga meditations can also helpful in cultural and practices. Another socio-cultural factor in planning the care is social organization. So social organization, that is family. Family has a main role in providing the care, isn't it? So there are two different types of family, like joint family. Then what is other family? Nuclear family, and individual who is coming from the joint family. They are dependent upon each other. The critical ill patient from this type of family usually get lot of support and help from the family members during the crucial period. There are also cultural difference related to expectations of the family members in providing the care. So under that, some patients may expect that family members will provide all care along with the healthcare provider. In contrast, some patients may like to resume self-care as soon as possible. So, if the patient feel that my family members will involve in the care, in that case, you have to, the critical nurse may support the family members or may need help, some assistance in from the family members during the care, so that the patient can feel better and can heal easily. Okay, so next factor, decision making in critical illness. So decision making in critical illness is another factor in planning the care. How? You can say how. decision making, family roles differ from culture to culture. Critical nurse must find out who should be contacted for providing necessary information related to care of the patient and who will take the members. So not every members the critical nurse will contact. So many family members are coming and contacting to the nurse, but the nurse should identify who is the accurate person who can give, who can take the decision for providing care to the clients regarding consent, regarding patient procedure, so everything. Okay, so that decision making, who is from the family members, she has to identify who is the person who can give the decision for the client for planning the care. Next, diet. Do you think that diet is very much important, is a socio-cultural factor in planning the care? Yes, isn't it? Yes or no? Yes or no? Are you able to understand? Diet has a role, or diet is a
Yes, ma'am. Yes,
socio-cultural
ma'am.
factor in planning the care?
Yes, ma'am.
Yes, because it will vary from culture to culture. Some culture will eat non-veg, some veg, and so many things in the diet is coming under socio-cultural factor. So, under the point, that is the socio-cultural factors coming, the socio-cultural factors in planning care. First one is communication. You go read, then if not understood, please ask in the next class. First one is communication. Second one is cultural.
Social culture.
Cultural health practice,
Third one is social organization.
social
That is
organization, family,
family has a great role in planning care. Then fourth one is decision making. It's a socio-cultural factor in planning care. Next one is diet.
Right.
After that, end of life issue. We have to cover another term, that is end of life issue in this um, in this unit one. Okay. So what is death and dying? Death. What is the meaning of death and what is the meaning of dying? Death is, what is that? You know or not? You know, death is a universal phenomena, inevitable phenomena experienced by the persons. Yes, and dying means the person who is going to death, approaches to death. Yes or no? So, as a critical care nurse, you should know who is death, who is regarding who is the patient going to die. So, because that, why? Why? What is the role of a nurse when a person is going to die? Tell me. You know regarding organ donation and autopsy in critical care? Yes or no?
Yes, ma'am.
Yes, ma'am.
So, what is autopsy?
After uh, death of a patient,
You have
donate any or to donate any organ,
before that you have to examine the body and
examine the organ.
to evaluate whether the person is having any chronic injury disease. Okay, so by that you should know whether the person is able to donate or not. So as a critical care nurse, you should know the person who are legally competent may choose to donate any body part or entire part. The decision to donate organ or entire body may be made by the person before his death. The decision to the donate an organ may be taken from immediate family members, and as a critical care nurse, you should know regarding autopsy, and this is an unexpected situation for the family, and families may particularly dislike for this procedure. Being a critical nurse, you should try to learn the family's views in this regard and obtain family permission before organ donation or autopsy. So, if while you are doing duty, if a person has already death or going to death, so you know regarding the procedures for autopsy, and you should know that there is a permission or consent required for organ donation or autopsy, because if you are caring to that clients, and if the procedure is done organ donation, so you should aware regarding the consent, the permission for the clients, because most of the organ donation occurs in while the patient is in the CCU. So next you have to understand what is grief responses. Grief responses. So grief is one of the most powerful emotional state and affect individual thought, feelings and behavior. Okay. So grief responses are one of the powerful emotions which will significant person grief develop from grief, so that people from different culture have different reactions to death and dying. People from Western culture believe that the death and dying is a private matter and can be shared only with significant members. But Indian communities, they have higher to express feelings of griefs. So this is all about your individual and family response towards patient and family. Individuals and family response towards that, that we have discussed. Critical illness. So this is your unit 1, individual and family response to critical illness. So under that, what we have discussed, we have discussed individual response to effect of critical illness and nursing intervention. We have discussed family response to effect of critical illness and nursing intervention. Then we have discussed socio-cultural factors which can affect critical care. After that, we have discussed end of life issue, that is your death corner, what is death, what is dying, what is organ donation and autopsy, and what is grief response. These are the points we have already covered now. So are you able to understand in unit 1? Clear
Hello,
about?
ma'am.
Yes.
Ma'am, please discuss about the topic you told.
Now, whatever the things I told.
नो मैम, वो सोशियो कल्चर उसके पहले जो जो था वो थोड़ा सा बोल दीजिए ना.
Socio-cultural before. So first one we have
Yes,
discussed.
ma'am.
First one we have discussed effect of critical illness of individual and family. Okay. Under that, 2 points are we have discussed individual's response to effect of critical illness and nursing intervention. After that, we have discussed family response to effectiveness, family response to critical illness and nursing intervention. Yes or no?
Yes, ma'am.
After that, we have discussed socio-cultural factor which can affect critical care. Socio-cultural factor. Under that, we have discussed socio-cultural term, what is culture, what is value, what is cultural imposition, what is trans culture. After that, I have discussed under that point socio-cultural factor affecting care. Under that, I have discussed socio-cultural assessment, socio different term. After that, socio-cultural assessment. After that, socio-cultural factor in planning care. Okay. Next point, I have discussed end of life issue. Under that, what is death, what is dying, what is organ donation, what is autopsy, and what is the grief response. Okay. So this is your unit 1. So shall we proceed to next unit? That is stress and crisis management in critical care. Yes, or any doubt?
No, ma'am.
Shall I proceed?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. So, under that unit, point is that stress and crisis management in critical care. So, what is stress and what is crisis? Do you know? So, what is stress?
Change the environment, ma'am.
Stress. We are feeling that we are having stress, isn't it?
Yes.
So, what do you feel? What is the stress?
Change the environment, ma'am.
Huh? Anything? Anybody can tell me? Anybody can tell me? Anybody can tell me what is stress?
Change any current situation.
What?
Stress is a mental condition. Um,
What is stress?
और अगर मायावती एक बहुत ही गरीब परिवार से जगह बन सकती है, इसका मतलब ये कि पिछड़े और दलित अब मजबूती की स्थिति में है। अब आप उनको कोई दिक्कत में आपके पास कोई दिक्कत।
These are some pictures. Yes. You feel the person is having under stress?
Yes.
Yes.
ma'am.
Yes or no?
Yes, ma'am.
Yes.
Yes,
Yes.
ma'am.
So what is that?
Stress is a mental condition and
What is stress? Stress is an internal state which can be caused by, it is an internal stress. Internal state can be caused by physical demands of the body, that is disease conditions, exercise, extreme of the temperature, and like, or by environmental and social situations which are evaluated potential harmful, uncontrolled, and exceeding our resource for coping. Okay. What is definition of stress? According to Hans Lee, stress is stress as the non-specific response of the body to any demand made upon it. And according to Richard and Lazarus, it is a stress focuses on relationship between the person and environment and is taxing or beyond his stress resources and harmful to his or her well-being. So next stress is considered to be, it's not actually. So it is a state that results from an event or changes in the environment of an individual which is perceived by him as challenging, threatening, or damaging to his health or well-being. So whenever you are find, for example, you are now you are in a stress conditions for your exam, for your practical, for your content, isn't it? So what is that? Because you are thinking that we might not getting accurate materials, the practical exam
Tension.
face, and how we are going to write the assignment, whether we have to only go through this content or we have to search for so many materials for writing the assignments. So like that you have stress. So what is that? Stress is a state that results from an event or a change in the environment of an individual. You are doing your regular activity, isn't it? Being a nursing officer, you are doing your duty, yes or no? Eating well and good, sleeping very nicely, you are enjoying your life, isn't it? But whenever you are entering a new course, that means something added to your life, something changed than your routine life, isn't it? Yes or no?
Yes, ma'am.
Yes,
Yes,
ma'am.
that is the stress. So it is a state that results from an event or a change in the environment of an individual which is perceived by him as challenging, threatening, or damaging to his health or well-being. Anything, maybe any change in the environment, any change in the environment of the individual to which
physically, mentally, any
individual
change.
whenever the person anything changes to his environment, maybe internal change, maybe external change. Internal change means whenever there is any disease conditions. So you have perceived that I may go to death, I may loses my kidney, my heart, if a person is going under a severe disease conditions. So anything change within internal or external, and unless and until we perceive it as a challenging, as a threatening or damaging, so we cannot under stress. So due to any changes externally or internally, whenever the individual perceive it that there might be some challenging situation, some threatening situation, some damaging situation to my health or my well-being, under that, after that, the person is under stress. So the individual is unable to meet the demands of the event or the new environment. Stress has been defined as a situation that exists when an organism is faced with any stimulus that causes disequilibrium between the psychological and physical functioning. All, all hormonal levels can be altered by stress. You know it, isn't it? So, what is a stressor? That is a stressor, an event or the change in the environment, maybe internal, maybe external stimuli that produces stress is known as stressor. The event, the things which can produce stress is known as stressor. An event or a change that is stressful to the person may not be stressful to another. And an environment that is stressful to a person one time or place may not be stressful at another time or place. This the thing is that some to some changes a person can stress but other person may be relaxed. Similarly, to a stressor a person can feel sometimes stress but not always. Sometimes after that also she can adapt, she can accept to that particular stimuli also she might not feel stress after that. Okay, are you clear or not? You have cleared.
Yes, ma'am.
So what is coping? Coping is the process of recognizing the stressor and adjusting or adapting to the changing situation to maintain one's health and well-being. So everybody, human being is always going through different stress. If no stress is not there, then nothing we can also gain. So stress is always with us, and we have to overcome that stress by using different coping process or coping mechanisms. There are also some defense mechanisms you can follow, but not always. Coping, what is that? Coping is the process of recognizing the stress and adjusting or adapting to the changing situation to maintain one's health and well-being. So it is a compensatory process. Oh, what is that? Coping. It is a compensatory process with physiological and psychological component. Stress will be experienced if there is mismatch between perceived demand and perceived ability to cope with the meeting the demands. There's mismatch between the stimuli and the coping ability, then that is with stress. So, what are the factors which can responses to stress? Different factors that affect the individual's response: internal factors, occupational factors, interpersonal factors, and intrapersonal factors. So, the first factors responses to stress is internal factor. So, what is that internal factors? Your factor, your health status, your genetic background. So, in genetic background, I can say here that the type 1 personality people are more prone to cross over stress, anxious than other type of other type of people. So, you know what is type 1 or type A personality? Have you know different personality, type 1 or type A, type B, type C? No or not? Anvesa.
No, ma'am.
So you know, type 1 but type A personality, they have more anxious, they have to do that. I can finish the work very nicely, and I can score good mark, no wrongs, no people, I should not get punishment, I should be perfect in every angle. So they are very anxious, and they are very prone to developing the stress. So internal factors like health conditions, if your health is not good, then you are under stress. The genetic factors, if genetic means the personality, the type of personality, if your father or mother, they are, if they are so emotional, so sentimental, and even easily affected by stress, then also it will your previous next generation will affected by this. Then previous experience with stress and personality characteristic, if repeatedly you are exposing same type of stress, that means you have also developed. Then external influence like your culture, religious, spiritual influence, socio-economic status, and support. If you are not socio-economically, so economically not so strong, then also at that time you have to under stress. Then how my child or my sons and daughters will study good, how I can give her good educational background, then social factor also. So these are the internal factors which can produce stress. Then occupational stress for the nurses. Occupational factor. So occupational factors not only for the nurses also, it can affect any working conditions which under the job. And for us, the factors are intrapersonal, interpersonal, and extrapersonal. Okay, grouped. So not only one factor in our occupation, our interpersonal, intrapersonal, and extrapersonal. So one by one we have to discuss. In intrapersonal factors, meeting needs of the patients and significant others, lack of knowledge or skill, inability in rapid decision making, s- lack of support, life stress, role of conflict, responsibility for the patient's lives, interpersonal. So intra and extra. What is intra? Intrapersonal factor कौन? Within ourselves. Huh? If we are not competent, if we have lack of knowledge, then that is a factor for while we are providing the care. Uh, we should competent. If we have competent, so less stress will be there. If there is a procedure that is intubation, and if you don't have any knowledge, what are the articles required for that intubation, then that will arise stress. So if you have ability, if you have rapid decision making ability also, and life stressors and conflict, these are also intrapersonal factors. So interpersonal. In interpersonal, that means poor communication between others. So poor communication, seniors, nursing staffs, uncertainty about patient treatment, dealing with experienced nurses and physicians, dealing demanding of the difficult patients. These are interpersonal. In between, that means the nurse and other personnel. And intra means within the nurse, what are the factors? And extra personal, too much workload, extra personal. Inter, intra, and extra. Are you able to identify? Yes or no?
Yes, ma'am.
So extra personal means too much workload, physical work, inadequate staffing, shift duty, floating duties of the department, or you are doing your shifting, suddenly you are shifting to another unit. Equipment failure, there is not available of proper equipment, BP instrument is not functioning, new equipment is coming to your ward, then noise, so much noise is there, inconvenient work environment, disorganized physical layout, poor unit alignment, no continuity in the patient assignment, lack of time to give emotional support. These are the extra personal factors. Then physical responses to stress. So, what is the physical response to stress? Tell me, how can you respond to stress? Physical, psychological, isn't it? So there is a term. Hans Selye named the physical responses as gas. GAS. Gas means Hans Selye कौन कहले जहाँ भी whatever the physical response that is under gas. That is
General adaptive system.
very good. General adaptive system. So under that, three phases are coming. First one is alarm reaction. Second one is resistance. Third one is stage of exhaustion. So these are the three phases which can coming under gas. So in alarm reaction, what will happen? This is the initial phase when the individual receives a stressor, physically or mentally. And sympathetic, that is fight or flight response, can be initiated. At this stage, the hormonal level rises, the heart rate increases, blood flow to the muscle also increases, oxygen intake increases, and there is greater mental alertness. So this alarm reaction is defensive but self-limited. So the person moves into the second stage. So what happens in alarm stage? This is the first stage of, tell me, anyone can tell me? What is these conditions? This is the, what is gas?
General adaptive system.
So this is the physiological changes to the stress or physiological response to the stress. And according to Hans Sally, so he named the changes as a three phases under gas. First one is alarm reaction. So this is the first step. Whenever we perceive a stress, whatever the initial reactions happenings within our body, that is hormone level rise, heart rate, oxygen flow, blood flow, these are rising, and this is the first stage. If we are not coping, then we go to the next phase, that is the resistance phase. So resistance phase, the body stabilizes and the hormone level, heart rate, blood pressure, and cardiac output returns to normal. Thus adaptation to the stressor may occur. This is the adaptation stress, that is the stress of resistance. And the amount of resistance to stressor varies among different individuals depending on the number of intensive of stressors, personal, internal, physical and psychological responses, reserves, and external social support from the family and friends providing support. So this resistance phase or adaptation phase varies from individual to individual depending upon the intensity of stressor, how intensity of the stressor, and the person's adaptive systems, his coping ability, his external support, external source. And if these internal reserves and external supports are adequate, then the person may successfully recover from a stress and can go to the normal state. And if this adaptation does not accurate or cure, then the person may go to stage of exhaustion. So this is the stage of exhaustion. It occurs when all the energy for adaptation has been spent. The magnitude of the stressor is too great compared to the person's physiological and psychological reserves. The individual stage of exhaustion usually becomes ill. The individual who is undergo this exhaustive phase is ill and may die if assistance from outside source is not available. Although stress response is usually protective, it can lead to pathological conditions. Variety pathological conditions like hypertension, heart disease, neurological disorders, infections, metabolic diseases, renal disease, digestive diseases can occur if the person is go under this stage. So, are you able to identify, or anybody can explain what is this gas, the three phases? Anybody from you can explain what is these three phases? Shortly or briefly, you can tell me.
Ma'am, gas means a physical response to stress, and its full form general adaptation syndrome, and it has three phases. First, alarm reaction, then resistance, then the stage of exhaustion. First, alarm reaction, it is a initial phase of gas, and in this phase the person is receive its pressure physically or mentally,
Very good.
and in this phase the patient pulse, heartbeat, oxygen intake, it's are increased, and then the person and it is on self-centered situation, and then resistance means uh, the the person is stabilized, and the hormones levels and heartbeat, blood pressure, it is normal, and and also it called adaptation state, and in this state the friends or family or others members support, provide support required for adaptation, and then the stress is returned to his or her previous and means he is gone to a steady state, and then the stage of exhaustion. If the patient is not resistant, then the patient is go to stage of exhaustion, and exhaustion stage, in exhaustion stage the patient is physiologically and psychologically reverse, and then the patient then the person is became ill and or may complicated.
Okay, very good. Nicely you have explained these things. Okay.
Thank you, ma'am.
So Anvesa, you are Anvesa, na?
Yes, ma'am.
Very good. You have explained, you have understood nicely and explained perfectly. So regarding this uh, gas, then so after that, this are all these alarm reactions, stage of exhaustion, and what is the second stage? Resistance. All are under physical response. Then emotional response. So can you tell me what are the emotional response reactions to the stress or the crisis conditions?
They'll be anxious,
Yes. So here, very emotional, strong emotional reaction that is called as crisis. So another thing I have to discuss regarding what is 1 minute. What is the sign symptoms of stress? So sign symptoms of stress. Anybody can tell me how we can identify the person is under stress?
depressed, anxious,
Okay.
Change the facial expression, and
Hmm.
Not working properly in not working
and
properly
unstable,
any work.
In present environment.
Hmm.
less focused,
Hmm.
You will be aggressive.
Okay. Some more things.
insomnia,
Hmm. How?
Loss
Other
of appetite.
loss of appetite. Then.
anxiety,
Hmm. What other things?
they'll have headache, tiredness,
Yes.
Lack of energy,
Lack of energy, very good.
less interest in work.
Huh?
Sometimes some people in stress they overeat.
Okay, then
Irritable,
irritable, very good.
There will
Headache,
be
dizziness.
burst of cry.
unable to enjoy yourself,
Unable to enjoy yourself, very good.
Helpless, hopeless.
overburdened,
So all the manifestation under four category we have also discussed: cognitive, emotional, physical, and behavioral manifestations. Okay. So under cognitive, what will happen? Memory problems, inability to concentrate, poor judgment, constant worrying. All these things we have also discussed. If people are said very nicely, then emotional, moody, irritability, feeling overwhelmed, sense of loneliness and isolation, inability to relax. Also, always feel pressure. Okay. So next physical symptoms, aches and pains, isn't it? Always aches, headaches. Most of the time we people are feeling migraine, headaches, so diarrhea, constipation, nausea, dizziness, chest pain, rapid heartbeat. So there are pathophysiology of stress. So that these things will happen. Loss of sex drive, frequent cold, increased heart rate, dilated pupil, tremors and sweatings. You know, there are also due to overstress, panic attack, and due to that these things will happen. Now, isn't it? Behavioral symptoms: eating more or less. Sometimes will loss of appetite, also sleeping too much or too little, isolating or oneself from others, using alcohol, cigarette. Some people using to relieve stress, they use alcohol, cigarette, drugs, etc. Then some people nail biting, that is nervous habit, pacing. If this happens, adaptation to environment create discomfort and themselves become stressors, called distress cycle. There are different things we have to discuss under that. So you know what is eustress and what is distress. There is a term. What is eustress and what is distress?
Eustress means positive stress and distress, negative stress.
Yes. Good. So these are psychological adaptation to stress, that is anxiety and grief. So anxiety may be different. Psychological adaptation to stressors are: some people feel anxiety mild, moderate, severe, and whenever the anxiety is most too much, that is panic state. So grief, you know, grief is a state of emotional, physical, and social responses to the loss of valued and objects. There may be different stages, and you have already known these things in your preview in your GNM or basic nursing course. That is your denial, anger, bargaining, depression, and acceptance.
Short
Okay,
form, ma'am, dabda.
what?
Dabda.
What you tell?
Short form of this stage of grief.
Ha, ha, ha.
Dabda.
That. So, uh, next things, what is this? Is, I want to see how the stress will perceive. So, under stress, what will happen? So, is it visible or not?
Yes, ma'am.
First of all, if there is stressor, so what will happen? The hypothalamus, there is a pituitary axis is there. So, in pituitary hypothalamic axis, the release of stressor, hypothalamus, and that stimulative pituitary release ACTS. ACTS full form, you know, adenocorticotropic hormones
Hormone.
which stimulate your adrenal cortex and release of cortisol. As you know, whenever you are under stress conditions, there is too much cortisol that will maintain your blood sugar level. Cortisol will maintain your blood sugar level and decrease your immunomechanism. Sorry, one thing. What is the role of cortisol? Cortisol is a stress hormone. Okay, and it will utilize more and more sugar will be. What will happen? If more cortisol will be secreted, then what will happen? Tell me. No idea. So in other aspect, autonomic nervous system under stress conditions, autonomic nervous system will be stimulated. That is a sympathetic nervous system. Adrenal medulla will stimulated, release of adrenaline, rushing adrenaline in the body. That's why your heart rate will be more and more rapid heart rate. Okay. So these are the mechanism of the then increase heart rate, blood pressure due to adrenaline, hyperglycemia because of cortisol. Excess amount of cortisol will produce hyperglycemia. You go and understood the physiology. This, this is your natural body's response. That is your flight and fight response will occur like that. Okay. So after that, we have to discuss what is crisis conditions. So what is crisis? This is your fight and flight response. So anybody can tell me what is a crisis condition? What is a crisis condition? So emotional reaction to stress, that is very emotional reaction is a crisis stage. So what is crisis? Crisis is the emotional reaction to very stressful event. Stress itself does not cause crisis, but the cognitive appraisal of the event may result in crisis. Actually, your IQ, your cognitive power produce crisis. So when an individual perceives the problem or the stressful event as insolvable and struggles to regain his control and the control of the environment, it becomes a crisis. Usually, a person reacts to the stressful event with various coping mechanisms, and crisis results when these coping mechanisms don't allow and the person to reach to the lower level of anxiety. Outcome of the crisis depends upon how the person deals with the crisis and what outside support is available during period of crisis. If you are not managing your stress level, if there is a failure of your coping mechanisms, at that time crisis situation arises, and if you cannot also get adequate support during your crisis periods, then you have to undergo different personality disorders. So, what is the phase of crisis? So, all the phases of crisis are divided into 4 phases. That is phase 1. The phase 1 in this person, a person problem is perceived in this phase, a person is confronted with a problem or stressor or a conflict that threatens and anxiety and other coping. Anxiety is also stimulate the usual problem solving tapering and other coping mechanism in an effort to solve the problem. After that, there is a next phase. Sorry, next phase is your phase 2, and this is the problem solving and other coping mechanisms fail and threat persist. Anxiety continue to rise. So in phase 1, what will happen? In phase 1, what will be there? Anybody can know? In phase 1, person is first faced to a stressor, and after that anxiety is developed. The anxiety stimulates the usual problem solving technique and other coping mechanism is an effort to solve the problem and lower the anxiety. The first one, in phase 1, the person is try to solve the problems and to try to lower the anxiety. That is your phase 1. Exposure to stress, response after after facing the stress, there is anxiety. Person tries to minimize the anxiety by trying to different coping mechanism. But in phase 2, so after using the coping mechanism, there may be solved or may not be the problem is solved. If the problem is solved and other coping mechanisms is fail, if the problem solving and other coping mechanism fail, the threat persists, anxiety continue to rise. Here, if the person is unable to adopt, she is failed to adopt the coping mechanisms, then anxiety instead of lowering, it rises in this stage. This rise in anxiety produces extreme discomfort. The person's functioning becomes disorganized. He or she begins to make trial and error attempts to solve the problem and restore a normal function. For example, in phase 1, uh, you have tried to, suppose you are not getting the study materials, you are feeling so anxious in phase 1, so you write to the principal madams and how, or in the group, how you will get the study materials, and your anxiety after writing, if this is your phase 1, and phase 2, if your problem is not solved, then you feel more anxious and extreme anxious, and again your anxiety level rises, but here again you try, you make trial and error, next you try another means once more you try to write, you try to also write letter to the IGNOU study centers. So this is your phase 2. Okay, your trial and error method continue, but anxiety level will be high. Then is phase 3. So in phase 3, if the problem solving other coping mechanism fail and threat persist, anxiety continue to rise. In phase 3, if in phase 2 your problem is not solved, it will continue phase 3. Again your anxiety will arise. He or she begins to make also trial and error method continue to solve the problem and restore a normal balanced state. If the trial and error attempts fail, anxiety intensify to severe and panic level here can arise. The anxiety level is more, that is the severe anxiety, and some form of a resolution may made this phase by either compromising need and redefining the situation to make the acceptable situation. And if this problem will be not solved, then the person will go to the next stage, and this is the anxiety overwhelm, and there may be some lead to serious and personality disorganization. Okay, and this is the final stage of adaptation syndrome, and a crisis may be seen, and if it is continue for a prolonged period, and there may be some burnout. Okay, there may be burnout syndromes. So this is the 4 phases. So are you clear what is the 4 phases? Phase 1, 2, 3, 4. This is the crisis phase. Crisis has 4 phases. Okay, so how many phases are there?
Four faces.
Four pages.
Like gas, it has 4 phases. Phase 1, 2, 3, 4. Third phase re panic attack, 4 phase re personality disorder, first phase re anxiety, mild anxiety, and the second re moderate anxiety, third re panic attack, severe anxiety, and fourth phase re anxiety overwhelm and personality disorganization. Clear?
Yes, ma'am.
Okay. So next we have to discuss another term. What is burnout?
Exhausted.
Yes. In 1975, Freudenberger. Okay. Okay. Who is that fellow? Freudenberger. 1975. First used this term to describe how how he used this term as a negative self-concept and a job attitude with a loss of concern and feelings for the clients. The burnout is a progressive stress process. It is a progressive stress process by which a previously committed professional person disengages from work as a result of the appraisal stressful transaction experienced within the job by Bailey 1985. And Maslach 1986 describes burnout as a syndrome. It is a group of manifestation of emotional exhaustion, depersonalization, and reduced personal accomplishment. Okay, this is the meaning of burnout. Clear? Are you able to understood the meaning of burnout? Yes or no?
Yes, ma'am.
So symptoms of burnout, symptoms of severe
Yes,
and
ma'am.
chronic, that is feeling tired, exhausted, frequent headaches, gastrointestinal disturbances, high resistance towards going to work. The person before going to work, she has hesitated to go to work. Frequent absenteeism means frequently CL never. Frequently she will take CL, EL. Okay. Stereotyping of the patient's rigidity in thinking and resistance to change, feeling of failure. Suspicious, paranoid personality will develop. Avoiding discussion at work with colleagues, isolate and withdrawal behavior. Excessive use of drugs, negativism, loss of purpose. Managing stress in critical care units. Next point is how will manage stress in critical care units. Under that, first there are many points, 3 points: nurse's own action, coping strategy, and last one is your importance of education and training. So under these 3 points, a nurse can manage stress in critical care unit by using first nursing actions. So only I am telling or going through one by one? So first one, recognition of the presence of stress. So nurse's own action under that. So 3 points is coming under managing stress in critical care. First point कौन हला? What is that first one?
Recognition.
9. Recognition हुआ. Before that, nurse's own action. Okay. First point is nurse's own action. Okay. Under nurse's own action, second point is coping strategy. Third point is
Importance of education.
education and training. So I have left the point nurse's own action. So what is nurse's own action? You have to recognize. First one, recognize the presence of stress in self and others. You have to identify that you are facing some stress. You have to identify that your body is under stress to physical sensation of your body. This will help in differentiating a positive stressor. When they mismatch your demand and coping strategy. When a nurse will fail, tachycardia, that I'm feeling stress. So how you will find? You have to see that your body will some changes, tachycardia, tachypnea, some aches, some fighting and fight and flighting response. So you have to identify your stress first. Recognize. Next point is stress of resistance. In stress of resistance, taking care, you have to identify the stress. In stress of resistance, you have to take care yourself, find out the stressors. You have to get proper nutrition, adequate sleep, rest. You have to manage yourself because you are a nurse and you know how to manage the level. And reading storybook by using certain relaxation technique, we can manage your stress. That is your resistance stage. For that, you have to effective coping strategy. You have to use coping strategy. So how will you manage your stress? First point, nurse's own action. Under that, you have to identify your stress. You have to resist, make some relaxation technique so that you have resist to the stress. And third one, you use some coping mechanism. After resistance, to avoid again and again more stress, you have to follow certain coping mechanism. So this is all about your nurse's own action. First point, under first point, nurse's own action. So the next point is that effective coping strategy. That is coping. Managing stress in critical care. Second point, after first point, nurse's own action. Under own action, 3 points covered: recognition, stress resistance, effective coping. Then second point, under managing stress in critical care, that is coping strategy. As you know, there are different coping strategy, maybe some direct coping and maybe some indirect coping. So direct coping and indirect coping, what is that? Or overall, you can write some coping. You can tell me how different coping methods are used. Overall, you can say. Tell me some coping methods.
Meditation,
Meditations, yoga. Then
listening songs,
yes, listening song.
read storybooks,
Then
Deep breathing exercises,
very good. Positive
uh,
attitude.
adequate sleep,
Then
proper nutritional diet taken,
diet. Then
by talking to others, sharing your feelings.
these are also some coping
meditation,
strategy. So there are long-term coping strategy, short-term coping strategy, some relaxation technique, meditation, inner light, supreme light. There are many things. Okay, so you can music follow music therapy, pet therapy. Yes or no? So different mechanisms are there. You can go and read easily. So last point is that importance of education and training. So what is that? Increase in the importance of education, increase clinical knowledge based on skills in critical care nurses are very important. So you enhance your knowledge. You go on continuing training. Okay, that's why your stressor will be more, you will be more competent and you will manage your uh, stress very nicely. So there is also the role of the organization and a nurse administrator for preventing burnout. How? Organization, adequate staffing, adequate instrument. Tell me one points. Open way communication, then periodic examination review. By that we can manage, or the nurse administrator organization can reduce the stress of the staff and prevent burnout, undergoing burnout of the staff. Okay. So all of these two unit have covered. Anything, any doubt? So under stress adaptation and crisis intervention, what we have discussed? What we have discussed? Tell me. We have discussed what is stress, what is stressor, what is occupational stressor, physiological response, a psychological response, signs, symptoms of stress, emotional reaction, that is crisis, what is burnout, and how we'll manage stress in critical care unit. That is using three steps, that is after pain action, coping strategy, and emotional importance of education and training. So these are all about stress and crisis management in critical care unit. You people go through the book, you study material, and if any difficulty you are finding, then tell me.
Ma'am,
Yes.
ma'am, please send this topic in WhatsApp group.
But this is
PPT.
all about I have prepared from your study material, IGNO material, copy paste just. Okay. One thing I want to show you, the time is there, so that I want to show you a video, but it time is not there. There is 6:15. Okay. So any doubt regarding this stress crisis management and the individual and family response to critical illness? So there are two other unit remained, that is communication. I think you have already studied in your basic level what is communication, what is therapeutic communication, and another thing is that what is guidance and counseling. These two units remain. So if there is any other classes, we'll cover it. any doubts if people are having, or we have to leave the class? Are you feeling any doubt?
Ma'am, can you share all the PPTs?
Good, 1 minute, 1 minute. Okay, what you tell?
Ma'am, can you share all the PPTs in the group?
Actually, this PPT, nothing more I have added only from the study material. You can also follow the study material. If anything,
Ma'am, I don't have in this study material.
I will send the only total block, because it totally I have prepared is from your study material. Only copy paste. Okay. So no other things I have added. Only the things I have another slide that I am showing you. So that is also very last. So I am sending all the 31 papers in your group, and you can follow that. Okay.
Okay, ma'am.
Class PPTs also.
Okay. So can you leave?
Yes, ma'am.
Okay. Thank you. Thank you very much. Your
Yes,
patience.
ma'am. Thank you, ma'am.
Okay.
Ma'am,
Okay. Tell me.
we have a doubt about regarding our exam, practical exam.
Practical exam, you doubt, you can ask whenever ma'am is coming. P. Lakshmi Bhai ma'am, ya Rajalakshmi Mishra ma'am, you can ask to them.
Okay, ma'am. Okay, ma'am.
Okay. So, may I leave now?
Okay, ma'am. Thank you, ma'am.
Okay. Thank you.
Thank you,
Thank
ma'am. Thank you, ma'am.
Thank you very much.